Let's start with the first BCQ. So, 57 years old farmer, current smoker, admitted with acute respiratory distress that rapidly progressed after leaving the corn silo. He and his son were loading the silo tower with corn when he suddenly becomes short of breath. He coughs up white foamy phlegm. His temperature is 37.2. Breath rate is 21 breaths per minute. Saturation 84. ABGs reveal pH of 7.35, PO2 7, PCO2 6.5, bicarb of 26. PFTs 1 year ago revealed FVC 82%, FEV1 64%, ratio is 62%, and TLCO 62% of predicted. He is a farmer and a smoker. Age is 57. Now have an acute exposure. Just after leaving a corn farm. And now he's become short of breath with some sputum and cough. Respiratory rate is a bit high. Low grade temperature. Saturations are low. He is hypoxic. So, as he had a background of smoking previously, his PFTs are revealing ratio is low, less than 75%. FEV1 is low, so obstructive. And TLCO is also low. Now, let's go to the other part of the question. This is the imaging. As you can see, this is a chest X-ray having a bilateral alveolar infiltrates more on the left side as compared to the right side, and some previous emphysematous changes as well. Come to the CT scan. On a background of emphysema, he had some ground glass changes, bronchiectasis bilaterally, but more on the left side. So, question. What is the most likely cause of acute respiratory distress in this patient? Inhalation of nitrogen dioxide, inhalation of corn dust, inhalation of endotoxins, inhalation of fungal spores, inhalation of pesticides. As he had a former history of farming, it could be pesticides, but it's not being mentioned in this scenario. It could be fungal spores, it could be anything of them. But this question is particularly asking about nitrogen dioxide. How come? Let's come to the discussion part. So what happened? There is a one disease named as Silofiller's lung disease, also known as a silo-unloader syndrome or Silofiller's disease. It is basically a respiratory condition in which exposure to toxic gases and dust found in silos and grain storage facilities. And this results into a production or release of nitrogen dioxide during the process of filling or emptying a silo. When these organic materials such as hay, grain or silage decompose, they release the nitrogen compounds that react with oxygen in the air and form the nitrogen dioxide gas. And these accumulate and can cause a respiratory problems, as in our patient. So, and these symptoms can range from mild to severe, may cause coughing, wheezing, chest tightness, shortness of breath, fever, flu-like symptoms, and prolonged exposure can result into lung inflammation, fluid accumulation, and even respiratory failure. How to prevent it? Proper safety measures in agricultural workplace, proper ventilation system, and using a proper respiratory protective equipments. and ensuring workers receive appropriate training and information how to work safely in these kind of places. So let's review again. A farmer, current smoker, presenting with acute respiratory distress. After just leaving the corn silo, he's short of breath and hypoxic. The imaging is showing some alveolar infiltrates, ground glass. So conclusion is it is because of inhalation of nitrogen dioxide.